In the last few years, I've seen more and more people with DMSc after their name. Often wondered, what exactly is it? What do you do in a Doctor of Medical Science? Is it just for PAs or is it a degree for other health professionals as well? Does the program entail additional clinical teaching or is it all strictly academic? Or is it research based? I really have no idea. So I feel so fortunate and excited to have Dr. Randy Danielsen on the channel.
Well, thanks, Michelle, and I really appreciate the opportunity to spend some time with you today.
So you currently are director of the Doctor of Medical Science program at A.T. Still University.
That's correct.
And how long have you been doing that?
I've been doing that since we created the program. It's been 2 years now.
Okay. Are there other doctorate medical science programs around the country, I assume, or is AT still the first one?
No, actually, AT Still was actually maybe the second or third. And now there's probably about 7 or 8 what we call post-professional Doctor of Medical Science programs, particularly for PAs.
Okay. I don't really know a lot about the Doctorate of Medical Science. Can you tell us a little bit about what that degree is?
Sure. And it's a great question because that is the biggest question right now. Why don't you just go back and get your PhD or go back and get your EDD or go back and get your doctor of whatever? Remember, PhDs, EDDs are what I call academic doctorates, and they take 4 or 5 years. So the concept started coming up about what we call professional degrees, particularly for PAs. Or a professional degree for a nurse, like the nurse practitioner, the DNP. We started saying, well, what's out there that's not the 4 or 5 years and the $150,000, $200,000 extra to go to a doctoral program. And so we got together and said, okay, we think that a program that's 1 or 2 years in length that focuses on things that a PA needs after they graduate. Number one, if they want to go into education, want to go into academia. Number two, if they want to move up in leadership in the military, the VA, the public health service, the institution that they're at, like Mayo or something like that. Or number three, do they want to get a doctorate that's going to enhance, not change scope of practice, but enhance their ability to be a practitioner? And we think we can do that with the curriculum, that's 1 or 2 years in length, so they can get out there and use that doctorate, to not only to benefit themselves, to benefit their practice, but to benefit the patient in the long run. That was a long answer, but yeah.
No, I think it needs a longer answer because it's a little bit newer and a lot of people don't really understand what it is. So I appreciate you explaining that. So is this degree only for PAs or can other people matriculate into this program?
Prior to the advent of the Doctor of Medical Science programs, there were a number of other professional degree programs out there. ATSU had one, the Doctor of Health Science. Nova Southeastern University had Doctor of Health Science. And that was particularly for anybody in the health field. Oh, okay. And many PAs have done that. However, we felt that we wanted to have a program that was specifically for PAs, that it was exclusively for practicing PAs and created by PAs for PAs kind of thing. Okay. So all of the DMSc programs out there that we compete with really are for the practicing PA with different focuses.
I have seen the Doctor of Health Science and I've been confused, like what's the difference and stuff. So thanks for clearing that up. So for this doctorate program for PAs, what is the curriculum? What does it focus on?
Our curriculum is probably similar to others. We have some core courses and then they break off into a track. For instance, we have a track for educators. And so we focus on what we think a PA educator needs. Or we have a leadership track and we focus on leadership skills that the PA should have if they're going to be moving into or up into leadership. Or we have what we call a professional track, which is really PAs who maybe want to change their focus of practice. Maybe you're in family practice and you would like to move into rheumatology, for example. And we provide a way for you to find ways out there to get more knowledge in rheumatology, and we work through you with that. And so, and then there's some other tracks that are coming down the road. We're looking at a global health track, or a community medicine track, those kinds of things. So the point is, we're looking for niches, if you will, that a PA says, I want to get my doctorate, but I'd sure like to spend time to be an educator or spend time to know more about global health.
Right. So just to clarify, make sure I understand correctly, just running with that rheumatology example you gave, so they attend different type of training programs elsewhere, and then that counts as work towards their doctorate. Is that what you're talking about?
Yeah, exactly that. The professional track, let's say that you wanted to move into rheumatology, since you brought that up, and the American Academy of Rheumatology has some great courses out there. So we basically have 4 courses. Look at them like buckets. And so you would set up your own learning plan, and you would say, okay, I'm going to take modules 1 through 15 for this first course in the ATSU program. And I'm going to take these, I'm going to show a way to verify that I took them. I'm going to verify that there was an assessment method so that I can be assessed that I actually did what I said I was going to do. And then there would be a dissemination part of that where they would share that information with other classmates, or maybe even write articles about it. So there'd be 4 courses that they would do that. And at the end, they would have the if you will, the knowledge and the assessment of that knowledge to show that they did that. Makes sense? Yeah. Right.
So is there any clinical courses, like when you said the core courses that everyone has to take, is there anything strictly like increasing their clinical skills?
No, the core and the leadership tract and the education tract and the global health tract, none of those are clinical, so, and people ask me, is this a clinical doctorate? It is not. And we need to be clear about that. And we need to be clear that getting a doctorate in whatever does not change your scope of practice. That's something that the state decides. However, the only time that there's going to be any clinical training that occurs is during those 4 professional tracks where you decide what you want to do, and you've brought in perhaps maybe even your own clinical preceptor to work with you.
Yeah, so that's interesting to know, because I was just talking to somebody who had done an emergency medicine fellowship, but or residency or whatever the appropriate title for that is, but they did it right after they graduated. And I was asking them, like, what about those people who have worked for several years and want to change? Was there anybody like that in your program? He said that no, most of them were all of them were new grads. And I was thinking, well, what about us? What about people who have been working, for a while and want to change? So this is a great option if they want to have a focused area of study.
And I might add, if you don't mind,
Sure.
we are partnering with a number of the post-professional residencies and fellowships to offer advanced standing for those who have, let's say they've done, a year a residency in emergency medicine. That 1 year will count advanced standing for those 4 courses that we talked about a minute ago. So 1/3 of the program they will already have had by doing their residency, and then we just need to do the other 2/3 of the program to get their doctorate. So we're partnering with a number of programs right now.
Oh, that's great. Yeah. That really helps cut down on the time commitment to be able to get this done. And so let's talk about that a little bit. You said it was about 2 years. Is that what you said earlier for a doctorate?
Yeah, and once again, it depends. Most of our students are either in what we call a 2-year tract or a 3-year tract. Our courses are 10 weeks in length, and we have 20-week semesters and two blocks in each semester. So a person who's in the 2-year tract would take 2 courses in block 1, 2 courses in block 2, and then repeat that in the next semester. Those who say, I don't want to do 2 courses a block, I'll do 1. And so that's sort of a 3-year time period. We've had people that have been in the 2-year track that say, oh, that's too much, move to the 3-year, and vice versa. We've had people say, I think I could do more.
I take it most of this is online then?
It is 100% online. It's asynchronous learning. It's what we call highly flexible online learning, and finding ways to maximize the online opportunities while these folks are working.
So they never have to come to the campus for any kind of exams or anything like that. It's all online.
That's correct. We invite them to graduation, and they're very excited about coming. We had our first graduation last June. We graduated 85 people, and it was a big party. We enjoyed it. Currently, our program cost for our DMSc program for this year is $600 a credit hour. Plus, there's a $32 technology fee. So it's $632 a credit hour, and there are 36 credits in the program. So whatever that is, you add that up, and you'll see that the DMS programs range from 18,000 to 30,000, depending on the institution. We're happy to say that the majority of our textbooks are free. They're ebooks. They're online, and also financial aid is available for those that qualify.
What type of positions are people normally wanting to get this degree for? What positions does it open the doors for? Yeah,
that's the elephant in the room, is it not? I mean, it's if I'm going to spend money to do this degree, what am I going to get out of it?
Right.
So we've already talked about what you don't get. You don't get a change of scope of practice. Right. You don't get a name change. You don't. But here's what you do get. And so number one, as you know, there's been a huge growth of PA programs in the country. Pretty soon we're going to have over 300 programs, and we have a huge problem of getting qualified faculty. And since all of our entry-level programs are masters, the recommendation is that you have a degree above where you're teaching. Okay. So we need doctorally trained educators in PA school. We don't have enough. And we don't have enough in the pipeline. So number one, we're seeing, particularly in our program that do the education track, people moving into education and getting sort of a step up because they've got that doctorate degree. Second one is leadership. And we're finding folks moving into what they call the C-suites, in institutions, or have a lot of military folks. We have a lot of public health folks who having that doctorate is going to give them an opportunity to move up into more leadership, higher level leadership opportunities. As I mentioned, the opportunity for me to move into a dean's position occurred because I was able to get my doctorate. And third, as we talked about, we're finding people just enhancing their clinical practice. And honestly, whether we like it or not, we are competing, with our nurse practitioner colleagues who have doctoral degrees. Right. And a lot of PAs say, okay, it's time for me to do that.
I know even when I went to PA school, which wasn't all that long ago, DNP was really becoming a thing. And we were all wondering, when are we going to have to get our doctorates in order to work? And I heard somebody say, you don't want to be the lowest credentialed provider in a clinic or this hospital situation. So do you feel like eventually that's going to end up being the terminal degree for PAs as a doctor?
Yeah. So a very controversial question. My short answer to that is yes. I think it's inevitable. I think it's going to happen. I think it's going to take a while. And if you talk to our educators out there, there's some huge issues with entry-level curricula that we would have to change. Number one, it would change the prerequisites for entry-level programs. It may even change the type of students that we bring into the program. We really have a push now for diversity and inclusion. It may affect that. So these things have to be answered before we move to an entry-level doctoral degree. So I think it's a decade down the road. Having a doctoral degree is, as you mentioned, is having a place at the table, but also is doing research on the profession. Our nursing college colleagues have done this for decades and decades and have done a great job in selling their profession because of the great research they do. We have some great researchers, but in the profession, we don't have enough. And we need more folks out there, doing research and showing just exactly what the profession is doing, because we've been the best kept secret for 50 years.
Kind of going back to what you're talking about, the challenges with making it a doctorate kind of being the necessary degree to practice, is when I first heard about it, my first thought was, well, then why didn't I just go to med school? If I'm going to spend 4 years, why don't I just go to med school?
Yeah, that's a very good point. And I guess it really comes down to, personally, why do you want to get a doctorate? I mean, obviously, if you want to get a doctorate to be a physician, then you need to go to medical school. But I think most of the PAs that I see, aren't interested in that. they would like to have I think you used the word before, a credential that's going to make a difference in their practice, in their leadership, in their academia, whatever it is, that they have that credential or that ticket, whether we like it or not.
Right.
It's part of the culture. And I've had people call me and say, well, when I do the Doctor of Medical Science, can I call myself a doctor in the clinic? I say, well, why would you want to do that? You
Right.
know, it makes no sense to me. And if that's what you want to do, then go to medical school.
Right. Yeah.
Some people would disagree with that, with my characterization of that.
Yeah.
But nonetheless, my recommendation to folks who are looking at that is they need to be clear from the very beginning why they want to get a doctorate, because they're going to be disappointed if it's not what they want.
There's a lot of people that don't do that who are doctorates, but I have known people that have a doctorate and walk in and say, hi, I'm Dr. So-and-so, and to a patient, and they just don't understand. I don't think.
And it may be illegal. In some states, you can't hold yourself out to be a physician. It's considered unethical conduct. So you have to be really careful about that.
Yeah.
But on the other side of that, if you've earned a doctorate, you should have that title where it's appropriate. I'm on the regulatory board in Arizona for PAs, and when they refer to me as Dr. Danielsen, just like they do the PharmD who's on there, who's a doctor. Right. And so I think we do our profession a disservice if we have a doctorate that we don't, I don't say flout it, but we use it appropriately to say people that we have the appropriate education for what we're doing.
Right. Are there requirements that you have to be a PA for any length of time before you go to the Doctor of Medical Science program, or can people go from undergrad to master's straight into their Doctor of Medical Science?
For our program, and I believe for the other DMSc programs, you can enroll in that program the day after you graduate from PA school. The majority of our students, however, are people that have been out 5, 10, maybe 15 or longer years and want to do something different. However, having said that, we've also started what we call an early entry program. And for selected second-year PA students who are doing well and think they can handle it, we actually enroll them early in the doctoral program, and they take some courses like medical writing, some introduction to doctoral foundation work, things like that in the second year to get sort of a head start. So when they graduate, they've already had a few courses under their belt. Some other programs, I think, are having some bridge programs. Where they'll bridge the entry-level program into the doctoral program. I think you're going to see much more of that in the future. However, what I would recommend for folks who are getting out of PA school who may want to move on to some additional training like a residency or a fellowship is to do that and then use that fellowship residency as advanced standing in a doctoral program.
Right.
That makes a lot of sense because they're actually getting that advanced training, clinical training, while they're working toward the end result.
Right. What do you think separates AT Still or makes AT Still a great choice for people to go get their doctorate?
First of all of those DMSc programs out there are excellent and are taught by many of our colleagues who I have a great deal of respect for. AT Still University has been, since its inception in the late 1800s, it's really been focusing on what we call whole person healthcare, taking care of the underserved. And so we focused on that. In fact, our entry-level program is focusing in partnership with federally qualified community health centers across the country, where our second-year students are spending all the second year with those in those clinics. And we're an osteopathic medical school, and we adhere to the osteopathic tenets of, like I said, whole person healthcare. And so we think that foundation that AT Still has really helps us, in our doctoral program, number one. And number two, like many programs, we've reached out to some of the best adjunct faculty in the country. The good thing about online education is you don't have to be in Mesa, Arizona. You can be anywhere. And in fact, we have students anywhere. I might add here, we've also reached out internationally to PAs in Canada and the UK. This program doesn't give them an opportunity to come to the United States and be a PA, but it gives them the doctoral program in their country. So we're looking at this globally.
So in this Doctor of Medical Science program, Is it similar to like a PhD program where you do a dissertation that you have to defend and all of that?
When the program was put together, we didn't want it to be a dissertation light program, because dissertations take years and years to do just by themselves, right. But we also didn't want to miss the opportunity, to have our students, be involved in different types of research. So we have a research course that all the students take. And then we have 3 what we call capstone courses, and so the students can decide: do they want it to be research based? Do they want it to be project based? Something that they could do in their clinic or in their institution, and they stay with the same capstone instructor for all 3 of those courses. And so it could be research, could not be research. So the first one is obviously the proposal, deciding what you want to do. The second one is gathering the information. And the third one is the dissemination of that information. And many of the students have done both research projects and non-research projects, and it's come out really well. Remember, you can't do full dissertations in 2 years. Right. So we do a smaller version of projects or research like that, and then at the very end, the capstone are usually published either in an article or a poster session or something like that in terms of getting the information out. And so it's not like a PhD or an EDD, but it is doctoral level research training. Okay.
So you kind of said something that sparked my interest. If there's something that you're working in an organization and you would like to see some changes made either in structure or how involved APPs are in the whole process or those kind of things, you could actually kind of take on something like that as your capstone project while you're making these actual changes in your position that you're working. Is that what I'm understanding?
Boy, you hit the nail on the head. We have one student who is revamping the EMS system in their city.
Oh, wow.
As their capstone. I mean, it's a big project, right. But they're really dedicated to reorganizing how EMS works there. And so we give them the skills to do that. And so you pick something that you love and something that means something in your practice. I mean, maybe you want to do a study in your practice over a year with your diabetics and looking at their A1Cs and to see, should we be doing something different? The diversity of ideas is great.
Yeah, that sounds pretty exciting. That's much more exciting than just, some kind of drier research to me. Some people love dry research and that's what they want to do, but it's great that you have that option, that flexibility in the program.
True.
So if people are interested, if PAs are interested in this and they want more information about your program, I assume that there's a website that they can go to that will get them started. I'll put that below in the description. Anything else that people need to know about if they want to start, how they should start checking into a program or getting information?
As I mentioned earlier, the most important thing, it's like ordering a lab test. You need to know what you're going to do with the results. Before you go to a doctoral program, you need to know what you want to get out of it. And then look at the programs out there. Every program out there has something for somebody, but you have to have the right reason. The last thing I want to do is to take somebody's tuition for 2 years and have them say, what a waste of time. It didn't do anything for me that I thought it was going to do. So you just make the right decisions. I think the DMSc is the post-professional degree of the future for PAs. I'm not talking about the entry level, but I'm talking about PAs out there who want to get that credential. I think the DMSc is a way to do that, unless you want to do the long version. So know what you're doing. Call and talk to folks like myself at the programs and get a sense of what the curriculum is all about, and talk to some alumni and say, why did you do this? And what value was it out there? Do your homework, just like you did before you went to PA school.
Well, thank you so much, Dr. Danielsen. It was a pleasure to talk to you. Thank you for everything that you've done for the PA profession.
My pleasure, and thank you for the time.
Your subscription really does help the channel to grow. Please like the videos, hit the subscribe button, and share with those who might find these videos interesting.